In healthcare, misunderstanding doesn't just cause inconvenience. It causes delayed treatment, wrong medication, and sometimes death. Children and families needing interpreters have nearly 2 times higher odds of serious medical events than English-speaking families. And communication-related adverse events cost U.S. healthcare systems $12 billion annually. Over 70% of patients with limited language proficiency reported limited interpreter availability. Even for common languages, risk remains. A University of California San Francisco study found Google Translate was 92% accurate for Spanish and 81% for Chinese in clinical instructions, which is a big risk when you think about the hundreds of millions of people who rely on those languages. I am Tamako Miki, a high school student at the American School in Japan. I built SafeSpeak Health to address one overlooked cause of patient harm: language barriers when interpreters aren't immediately available, especially in rural and under-resourced settings. SafeSpeak operates in 2 modes. Offline mode for under-resourced settings where Wi-Fi may not be available or even at home. The app uses pre-validated medical phrase libraries. If the symptoms are outside the library's phrases, the system directs the user to a professional, as the symptoms are likely complex. So built-in risk classification scoring and escalation alerts. And at the end, teach-back confirmation to verify understanding. And online mode for when a professional is present, including AI-assisted medical translation, trained on medical documents from non-English languages. Every interaction is securely logged to provide clinicians with structured documentation of the communication exchange. As communication complexity increases, risk scoring adjusts. When risk crosses a threshold, the system flags for professional interpreter escalation. Using Blue Ocean strategy, we focused on 3 tiers of non-customers. Rural clinics with limited interpreter access, underdeserved communities are priced out of current solutions, and regions never considered viable due to infrastructure constraints. These settings represent the majority of global environments and the true blue ocean. Today, the industry competes predictably. Professional interpreters offer high safety but low availability and high cost. Phone and video services improve access but remain connectivity dependent and expensive. Generic AI tools are low cost but lack medical safeguards. No solution integrates safety, offline functionality, and cost efficiency together. SafeSpeak raises patient comprehension and risk control, increases offline functionality, and lowers dependency on per-minute interpreter costs. It redefines what the industry competes on. We eliminate unsafe ad hoc translation, reduce waiting time caused by language barriers, raise comprehension and equity, and create new elements: offline medical functionality, risk classification, and teach-back verification. SafeSpeak operates on a subscription-based model. Clinics pay an annual per-site license fee with tiered pricing based on facility size and language needs. Because SafeSpeak reduces reliance on per-minute interpretation services and requires minimal infrastructure, it creates built-in cost savings while remaining scalable across facility networks. SafeSpeak will pilot in Tokyo community clinics, serving foreign residents, then expand to rural municipal hospitals across Japan, where interpreter access is limited. From there, we will scale to U.S. rural health centers before partnering with NGOs for deployment in low-infrastructure regions. To validate real-world need, I reached out to public health professionals, clinical researchers, and health equity leaders. One director of public health described language barriers as a major challenge in her work and raised an important concern. Medical translation is not just about language accuracy, it's about cultural framing. She explained that even medically correct terminology can fail if it doesn't match how communities understand health issues. Based on this feedback, SafeSpeak incorporates multiple phrasing pathways, cultural sensitivity considerations, and clear boundaries on when professional interpreters must be involved. Language should never determine survival. SafeSpeak Health redesigns clinical communication around safety, not just translation. By structuring conversations, verifying comprehension, and operating offline, we increase patient protection while reducing reliance on costly per-minute interpreter services. That combination of higher safety and lower cost creates our blue ocean.